What parent out there hasn't watched their kids sleep? Well, researchers are now saying you might want to watch and listen just a little more closely. Do your little ones snore a lot? Do they breathe through their mouth or even stop breathing periodically through the night? A new study suggests so-called sleep disordered breathing is linked to behavioral, even emotional problems in young children. And joining us to explain all of this is CBC medical specialist Dr. Karl Kabasele. What is the link between sleep disorder and behavioral or emotional issues?
Well, the problem here is probably some combination of lack of rest. You know, the brain needs the time during the night when you're sleeping to kind of organize itself and to rest, and also the oxygen supply to the brain as well. So whether you're a child or an adult, if you have sleep apnea, where you stop breathing periodically through the night, that can have an impact on the amount of oxygen you get to your brain. So these are some of the ideas as to why these kids, when they have these problems, may go on to develop not only the emotional and the behavioral problems, but also intellectual problems, where they may have problems learning as well.
So give me more. If kids are not getting enough sleep, what do you see?
Well, what you see in terms of the symptoms to look out for when a child is sleeping, if you notice they stop breathing or seem to be holding their breath periodically through that period, that's a sign of sleep apnea, obviously. But
they start breathing.
They start breathing again, of course,
right,
yeah. But the more common thing that you might observe is either mouth breathing or snoring. And, you know, snoring can actually be a sign that there's some obstruction in the airway that can be basically solved by either surgery or having the child lose weight if that's the reason why you're having a lot of obstruction in the upper airway.
So how can the lack of oxygen affect the brain when you talk about learning disabilities, things like that?
Well, the extreme example is when someone has a stroke. When blood supply is completely cut off to the brain, you know, brain tissue dies. But there is emerging evidence that if even with small deprivation of enough oxygen along the way, that can cause, you know, changes in the brain or damage to the brain in small amounts. So the issue again here is that if that happens at a very young age, then as the child gets older, they have problems with what we call executive functioning, so concentration, memory, you know, basic things they need to do well at school. But also hyperactivity seems to be more likely, as well as an inability to sort of regulate emotion and regulate level of arousal or excitability. All of those things can obviously take away from learning.
So what can parents do then? I mean, you can't have parents standing over the crib or over the bed all night, because then they wouldn't be getting enough oxygen to the brain, and you don't want that. What should they do? Well,
that's right. So if you observe your child snoring or breathing through their mouth, or even if, you know, you look in on your kid every now and then and you notice their breathing seems to be interrupted, bring it to the attention of the pediatrician or family doctor. The researchers in this particular case say that doctors should be also eliciting more specific information. So when a child comes in, sometimes the doctor will say, well, how's your child sleeping? But there should be more specific questions. Do you notice snoring? Do you notice the child stops breathing? And do you notice that the child doesn't seem to be able to breathe through the nose and is breathing through the mouth? And as we discussed earlier, the treatments for that may include everything from surgery to losing weight, and possibly, you know, those appliances that help to keep the airway open, which can be a little more difficult to use in younger children, of course.
And you know how some people say when kids have asthma, oh, they'll grow out of it. Is this something you grow out of?
Well, yeah, these things tend to sort of peak at an early age, say around 1 or 2 years old, and then get better. But of course, if they're not dealt with, if there's no intervention, then you're exposing the child to a greater effect. According to this research, you know, the longer the child is exposed to these symptoms or having this problem, the more likely they are to have problems down the road with their behavior and emotions and hyperactivity and all those things.
So many things to worry about as a parent. You know, I'm a parent. There's just always so many things to worry about. Thank you, Karl. That's CBC medical specialist Dr. Karl Kabasele. They have